Psychiatric nursing is theoretically grounded, and a wide array of theories form the basis of psychiatric nurse role. This chapter reviews the concepts of biopsychosocial theories that underpin psychiatric nursing practice. Let's look at the objectives, evaluate the premises behind the various therapeutic models discussed in this chapter, describe the evolution of therapies for psychiatric disorders, identify ways each theorist contributes to the nurse's ability to assess a patient's behavior. Provide responses to the following based on clinical experience. An example of how a patient's irrational beliefs influence behavior. An example of countertransference in your relationship with a patient. An example of the use of behavior modification with a patient. Identify Pepper's framework for the nurse-patient relationship. Choose a therapeutic model that would be most useful for a particular patient or patient problem. So the psychological theories help us to explain the patient's behavior. Most of the psychological therapies, psychotherapy, individual psychotherapy, psychoanalysis, behavior therapy, or any types of therapy are based on these theories. Our nurse-patient relationship is based on some theory. So this chapter is an overview of theories and therapies and their relevance to nursing and psychiatric mental health nursing. So let's begin with psychoanalytic theories and therapies. So Sigmund Freud is an Austrian neurologist. He came to believe that a vast majority of mental disorders were due to unresolved issues that originated in childhood. He was working with people with conversion disorder or hysteria, where psychological problems has contributed to their behavior, or they have some symptoms but there are no physiological cause. For example, a patient is having blindness, but physiologically he is not blind. He can see, his optic nerve is functioning properly, his retina is functioning properly, but he is blind. So he's thought that there are some, why is the patient is having this issue? There must be some unresolved conflicts or issues behind this physical symptom. So based on that, he developed this theory, psychoanalytical theory. So his theories considered many things like catharsis, talk therapy, free association, where a patient would vent out his feelings or emotions so that our underlying conflicts can be resolved. He also mentioned that there are 3 levels of awareness: conscious, preconscious, and unconscious. So he used the image of an iceberg to describe these levels of awareness. The conscious part is the tip of the iceberg. It contains all the material a person is aware. It includes the perceptions, memories, thoughts, feelings, fantasies. It is in the conscious memory. What is in the preconscious? Preconscious is just below the level of awareness, where with thinking about it, we can retrieve those information, which we are not thinking every day, but at times we can look back and retrieve those memories. That is in the preconscious. Next is unconscious. These are things which we don't want to retrieve. These are all in the unconscious mind. For example, a trauma that happened. The person does not want to revive those memories. These are in the unconscious memory, the things which we don't want to remember. These are some memories, some emotions associated with trauma. These are all in the unconscious memory. So Freud said that with the use of a trained therapist, these things in the unconscious mind can be resolved, and so the patient does not exhibit behaviors based on these unconscious conflicts in the mind. This picture shows a mind as an iceberg. There is conscious, preconscious, and unconscious. Then Freud again said the structure of a person, or a personality structure, has 3 major parts. He said there are id, ego, and superego. Id is basically your pleasure principle. These are based on your drives and instincts, like your urge for hunger, your thirst, sex, aggressive needs. These are all in the id. When a child is hungry, he needs food. An infant is hungry, he needs food at the moment. So a person who is stuck in this id wants the things to be done now. That is pleasure principle. But once we get older, everyone moves from this stage to another stage where we can wait to satisfy your gratification needs. We are just not okay, I'm feeling hungry, I'm just going out of the class, I'm going to have a burger. No, I know that there's a break coming up, and I'll wait and go outside when there's a break. That is the ego, or the reality principle. These are things like it's a problem solver, or we are in reality with the outside world. That's the ego, or it's just otherwise known as the reality principle. Then next one is the superego. Superego is your morality principle, your morals, your values, your things which we inculcated from our culture, our values, our religion, all makes this superego, or your conscience. That is the superego. Okay, so that's mind as an iceberg. There are three parts: conscious, pre-conscious, and unconscious. And your personality system is divided into three again: id, ego, and superego. So this slide again explains the personality structure. There's id, ego, and the superego. So id is the pleasure principle. It is mainly your instincts, your primary instincts or drives. That is the id. Ego is the problem solver, reality. We know what is to be done, and these are, you can delay the gratification. We can wait. That is the ego. And then comes the superego. That is the moral component. Freud further explained about defense mechanisms and anxiety. So anxiety arises when there is a conflict between id, ego, and superego. So when we have to decide something, because there's a conflict between id, ego, and superego. For example, I have an alcohol issue. Your id is saying, I just want to drink. Ego is saying, if I drink now, I think I need to get a treatment. If I drink now, I might end up drinking heavily and it affects me. You see, superego might say, no, it should not be done because your wife is waiting at home, or your boyfriend is waiting at home, or your family is there. Please don't do it. Your religion, your culture does not allow it. So that causes an anxiety, and the person has to decide, okay, what should I do now? Should I just drink, or should I just skip it? It causes an anxiety. So we use some defense mechanism to control these anxiety. Okay? One might say rationalizations. One might say, oh, it doesn't matter. I just have wine. One sip of wine would not kill me. Or someone say, I don't have an issue at all. That's a denial. He uses that defense mechanism to control those anxiety. So some coping skills are good. Some are not. So there are adaptive coping skills and maladaptive coping skills. So these are operate on your unconscious level. Okay? So we'll look into more defense mechanisms in detail now. So Freud said, a person has anxiety, which can range from mild to moderate anxiety, severe and panic level of anxiety. So when we have anxiety, we use defense mechanism to control this anxiety, which is usually by the ego part, the reality principle. We are using some coping mechanisms. Some certain coping defense mechanisms that we utilize are denial, projection, regression, repression, reaction formation, rationalization, undoing, intellectualization, suppression, sublimation, and altruism. So let's look at each one with an example. So denial is refusing to acknowledge the existence of a real situation. For example, a woman drinks alcohol every day and cannot stop. Failing to acknowledge that she has a problem is denial. Next is projection. Projection is attributing feelings or impulses unacceptable to oneself to another person. For example, a person feels a strong sexual attraction to her coach and tells her friend, he's coming on to me. She's projecting those feelings towards the other person. Next is regression. Regression is going back to your developmental milestones. For example, a child was not bedwetting or had toilet training. But then when the sibling was born, he regressed and he is now bedwetting. So that is regression, that is retreating in response to stress to an earlier level of development. That is regression. Next is repression. Repression is blocking the feelings or experiences from one's awareness. For example, an accident victim can remember nothing about his accident. Okay, that is involuntarily blocking unpleasant feelings and experiences from one's awareness. That is repression. Then what is reaction formation? Reaction formation is we have a feeling, unacceptable or undesirable thought, and we try to express it by using opposite thoughts or types of behaviors. For example, a person does not want to take care of her daughter or feels that daughter is taking away all her time. But rather than showing negative feelings towards the daughter, she's trying to do reaction formation, trying to love the child and do opposite things, loving and caring and playing with her, and so that her unconscious feelings are not shown. She's showing an opposite kind of behavior. Another example, a person hates nursing. She attended the nursing school to please her parents. But during the career day, she speaks to the prospective students about the excellence of nursing as a career. That is reaction formation. Next is rationalization. That is attempting to make excuses or formulate logical reasons to justify unacceptable feelings or behaviors. For example, John tells the rehabilitation nurse, I drink because it's the only way I deal with my bad marriage and my worst job. That is rationalization. There's some logical reasoning. Next is undoing. A person fights with his wife. When he comes back from work, brings her a flower. That is undoing, symbolically negating or cancelling out an experience that one finds intolerable. Next is intellectualization. That is an attempt to avoid expressing actual emotions associated with a stressful situation by using the intellectual process of logic, reasoning, and analysis. For example, a person, their family, her husband got a new job and they're transferring from a city to another place. The woman has a lot of anxiety about moving, but explains to her parents about the advantages of moving. So that is intellectualization. Another ego defense mechanism is suppression. That is voluntarily blocking unpleasant feelings. In repression, we said it is involuntarily blocking. Here, we are voluntarily blocking unpleasant feelings and experiences from one's awareness. For example, my boyfriend is cheating on me. I don't want to think about it. Okay? I'm trying to voluntarily block those unpleasant feelings and experiences. That is suppression. Or I have an exam tomorrow and I have all these stresses and things that I have, and I don't want to think about it right now. I'll think about that tomorrow after the exam. That is suppression. Next is sublimation. That is rechanneling drives or impulses that are socially unacceptable into activities that are constructive. For example, a mother whose son was killed by a drunk driver channels her anger and energy into being the president of the local chapter of Mothers Against Drunk Drivers. That is sublimation. Next is altruism. Altruism is doing things for others to make yourself feel better. That is altruism. So we looked at various ego defense mechanisms. Some may be a mature defense mechanism and some are immature defense mechanism. Freud believed that there are some instincts, urges, and fantasies that motivates our thoughts, feelings, and behaviors. So he mainly looked at two drives. One is sexual drive, another one is aggressive drive. So he said that in each stage of development, a person has to achieve certain drives or tasks. If that tension or the drive is not satisfied at that stage of development, he can develop personality disorders or maladjustment in adulthood. So he mainly looked at 5 stages of development: oral, anal, phallic or Oedipal stage, latency, and genital phase of sexual development. So according to Freud, in oral stage, that is about 0 to 1 years of age, the main source of satisfying this drive or the instinct is by sucking, chewing, feeding, crying. So there's a mastery of gratification of oral needs. So what if that stage is satisfied, the child develops a trust in the environment. He realizes that his needs can be met. If those stages are not developed, patient can develop, or this person can develop smoking, nail biting, substance abuse, schizophrenia, paranoia. And then is the anal stage, that is 1 to 3 years. Here the primary source of satisfaction is expulsion and retention of feces. That's when the toilet training comes up, right? So the primary task is beginning of sense of control. If that is not able to achieve, this person can develop obsessive compulsive disorder, destructiveness, depressive disorder. Kind of like if the anal stage is not achieved and the person is fixated at that stage, it's kind of this person develops habits of rigid patterns or stinginess, thoughts, obsessive compulsive thought patterns. So that's what the Freud believed. Next is phallic stage or Oedipal stage, that is 3 to 6 years. That's when the children begin to explore their genitals, starts masturbation, maybe just trying out, exploring their area. The primary task is sexual identity with a parent of the same sex and beginning of superego development. They identify themselves with if the boys will identify with their fathers and females will identify with their mothers. So fixation at this stage can cause sexual identity disorders and inability to love. The next phase was latency of 6 to 12 years. So he said latency stage is usually from 6 to the puberty age. Here the person is developing relationship with friends and learning motor skills development, developing the social skills. So the development of these skills will help them to cope with the environment in the future. If those needs were not satisfied, he will lose the ability to make adequate social skills, or feeling inferior, and there is inability to form any kind of social relationships. Next is genital phase, 12 years and beyond. So that is puberty and forward. Main task is development of satisfying sexual and emotional relationship. So the ability to be creative and find pleasure in love and work is the desired outcome if this desire is satisfied. If the person did not satisfy these needs, or did not find any emotional relationship during this phase, the person can have problems with satisfying intimate relationships or sexual perversion disorders. So that was about psychoanalytical theory or the Freud psychosexual stages of development. So what are some implications of this theory in nursing? So the Freud's theory of unconscious mind is considered valuable so we can identify the root cause of problems. But it is seldom used today because intrapsychic conflict is no longer considered to be the cause of all mental illness. Next is the important concepts from this classical psychoanalysis is transference and countertransference. We still use these concepts. The transference is the feelings that the patient has towards the healthcare workers, and countertransference are feelings that nurse develops towards the patient. So identifying these transference feelings, we can explore them with the patient and help them to identify their thoughts and behaviors and attach it to their feelings, what they're feeling inside. And countertransference, similar feelings that we have towards our patients. So it will be helpful to have a mentor, or helpful to have a supervisory guidance at times to talk about our feelings. And some amount of self-awareness will help us to deal with these countertransference issues. So according to Freud, which aspect of the personality motivates an individual to seek perfection? Id, ego, superego? Not sure. If you said superego, that is correct. The superego represents the ideal rather than the real. It seeks perfection, as opposed to seeking pleasure or engaging reason, or the morality principle. So psychodynamic therapy is a newer psychoanalytical model which uses the techniques. It focuses more on the here and now rather than looking at the unresolved conflicts. So it uses the tools like free association, catharsis, transference, countertransference, and it helps to explore the issues. So the best candidates are the worried well, who have a clear area of difficulty, they are intelligent and well motivated for change. The main focus is established early and clear expectations are established, and the therapist says that it's a time-limited therapy and there's a specific goal that needs to be achieved, and it focuses on improving coping skills and helping the patient to improve their worst symptoms and helping the patient understand what's going on in his or her life. So the interpretations are directed towards the present life circumstances and patient behavior. And the understanding is that the psychotherapy does not cure, but it can help troubled individuals learn to better deal with life's issues or stressors. So we will take a break here and we will deal with the rest in the next sessions. There's a part 2 and a part 3. Thank you.